At the end of September, the Centers for Medicare and Medicaid Services announced that Medicare Part B premiums and deductibles would slightly decrease for 2023. Medicare Part B covers routine doctor's visits and other outpatient care. It also covers some durable medical equipment and preventive services. In 2023, the standard Part B monthly premium will be about $164.90. The annual deductible for Part B will decrease to $226. It's a small decrease, about 3%, but it's rare to see a decrease. The Centers for Medicare and Medicaid Services are actually attributing the decrease to a couple things. The first one is pretty big, a lower than expected cost for a certain Alzheimer's drug. That one drug was responsible for about a $21.60 increase for 2022 Part B premiums. The Centers for Medicare and Medicaid Services said there are other things that go into the slight decrease, such as lower than expected spending on Medicare services and items in the past year. In his remarks, President Joe Biden said a big cost and a big concern for most folks is prescription drugs and other health care. Reducing that cost and concern is one of my top priorities. He was giving remarks in the Rose Garden at the time, and he also reminded folks that more savings are coming thanks to the Inflation Reduction Act. The act requires Medicare to cover the cost of recommended vaccines, to cap monthly insulin copayments at $35 per month, and to allow Medicare to negotiate directly with drug companies. Biden continued, "We pay more for prescription drugs than any other advanced nation in the world, and there's no good reason for it." He says, "For years, many of us have been trying to fix this problem, but for years," and he stressed, "for years, Big Pharma has stood in the way." He says, "Not this year. This year, the American people won." There are some other Medicare changes coming for 2023. Some recipients of kidney transplants, for example, who would normally lose Medicare coverage, can continue Part B coverage of immunosuppressive drugs by paying a premium. Part A and Part D cost sharing will increase slightly next year as usual. And remember that annual enrollment period for Medicare Part D and Advantage plans starts October 15th and runs through December 7th. You can read more from the federal government. We link to some resources in the description below.